For men over 60, discussing intimacy and sexual health often feels like walking a tightrope. There's a prevailing myth that as we age, we must simply retire from this aspect of life. That could not be further from the truth. In fact, maintaining a healthy, satisfying sexual life, including masturbation, is vital for both physical and psychological well-being at any age. I'm Dr. Sara Malik, a urologist dedicated to men's health across all decades. Today, we're having an honest, clinical conversation about safe masturbation after 60. It's not about shame, it's about science and avoiding common pitfalls. We'll break down the 5 biggest mistakes that can cause pain, injury, and frustration, and give you the simple rules to keep your solo activities safe, enjoyable, and healthy. Educational breakdown: the science of age. Let's establish the physiological facts. After 60, 2 key things change: blood flow and tissue elasticity. Years of wear and tear and conditions like diabetes or high blood pressure often reduce penile blood flow. Less blood flow means less lubrication and slower arousal. Secondly, tissue rigidity. Collagen fibers and elastic tissue change. The skin becomes thinner, more fragile, and less elastic. This means the tissue is more susceptible to micro tears, bruising, and minor injury if treated roughly. Understanding these changes is the first step toward safety. Now, let's talk benefits. Masturbation helps release endorphins and dopamine, improving mood, reducing stress, and even promoting better sleep. Furthermore, regular ejaculation, as advised by some studies, can help flush out the prostate ducts, potentially reducing the risk of conditions like prostate cancer. It is essential self-care. Avoid these 5 big mistakes. Mistake number 1: ignoring lubrication. This is the most common and dangerous mistake. Due to age-related changes, natural lubrication is reduced. Engaging without sufficient moisture drastically increases friction, leading to skin chafing, micro tears, and potential bruising, which can take weeks to heal. Mistake number 2: the go fast, go hard mentality. Your tissue is not as resilient as it was at 20. Excessive speed, aggressive gripping, or forceful bending can cause serious issues, including Peyronie's disease, scar tissue formation, or even minor fractures. The goal now is pleasure, not setting a speed record. Mistake number 3: relying on habitual, repetitive patterns. Your body adapts to routine. Using the exact same grip, speed, or angle every time puts continuous stress on the same skin and nerve pathways. This can lead to desensitization and, ironically, a lack of satisfaction. Introduce variety, switch hands, and change grip pressure frequently. Mistake number 4: not listening to your body, ignoring pain. Any sharp pain, burning sensation, or discomfort is a red flag. Do not power through it. Pain after 60, especially in this area, can indicate an underlying condition like a vascular issue, early signs of Peyronie's, or even a localized infection. Stop immediately, assess the cause, and if it persists, see a urologist. Mistake number 5: neglecting foreplay and arousal time. Arousal is slower. Trying to jump straight into intense stimulation without a proper warm-up means the tissue isn't prepared, increasing the risk of injury. Take 5 to 10 minutes for gentle, non-genital stimulation first. Build anticipation slowly. A longer, more relaxed journey is the key to a safe and rewarding climax. The safe and effective technique. Guide Rule 1: the open hand, light grip. Use a loose, open hand, focusing the pressure evenly over a larger surface area rather than a tight death grip. The pressure should be firm enough for sensation but gentle enough that you could easily maintain a conversation. Rule 2: focus on the base, the anchor. Many men focus only on the tip. after 60, focusing on the base and shaft with a slow massaging action can improve blood flow and provide a deeper, more satisfying sensation while protecting the more fragile skin near the tip. Rule 3. Integrate pelvic floor work. Use your PC muscle, the Kegel muscle, to enhance sensation. Contract the PC muscle rhythmically during stimulation. This draws blood flow to the area, improving hardness and sensation naturally. It's a dual benefit, exercise and pleasure. Clinical Q&A now. Let's address some of the most common questions and concerns I hear in my practice regarding masturbation after 60. Q1. Is it true that ejaculation frequency is harmful, or are there benefits? A. This is a common concern. For most men, a healthy frequency is whatever feels natural and comfortable. In fact, some studies suggest that regular ejaculation, around 4 to 7 times a week, can help flush out the prostate ducts, potentially reducing the risk of conditions like prostate cancer. It's generally seen as beneficial, not harmful. Q2. What if I struggle to achieve or maintain an erection during masturbation? A. This is incredibly common after 60 and often due to age-related vascular changes, not a lack of desire. Use this time to focus on non-erect sensation, touch, and pleasure rather than performance pressure. The key is to enjoy the process, not just the outcome. Don't pressure yourself for firmness. Q3. Can masturbation cause prostate enlargement or BPH? A. There is no scientific evidence to suggest that masturbation directly causes benign prostatic hyperplasia, BPH, or prostate enlargement. In fact, as mentioned, regular ejaculation may even have protective effects for prostate health, so no, it's not a cause for concern in that regard. Q4. What if I experience pain after masturbating, even if I'm careful? A. Any persistent pain, even minor, should never be ignored. This could indicate an underlying issue like a vascular problem, inflammation, or even early signs of Peyronie's disease. If you experience discomfort that doesn't resolve quickly, please schedule a visit with your urologist to get it properly assessed. Q5. Is it normal to feel guilty or embarrassed about masturbating at my age? A. Absolutely not. This is a crucial point. Unfortunately, societal norms often create unnecessary shame around senior sexuality. Masturbation is a natural, healthy, and private act of self-care. It benefits your mental well-being, mood, and even physical health. There is nothing to be embarrassed about. We've covered a lot today. Remember the 5 big mistakes to avoid: ignoring lubrication, the go fast, go hard mentality, relying on repetitive patterns, ignoring pain, and neglecting foreplay, and integrate the 3 rules: the open hand, light grip, focus on the base, and pelvic floor work. Masturbation after 60 is not just permissible, it's a vital part of maintaining your overall physical, mental, and emotional well-being. It's a healthy outlet, a stress reliever, a mood booster, and a way to stay connected with your own body. You have a right to a fulfilling life, and that absolutely includes your sexual health. Don't let myths or misinformation diminish your well-being. If you found this guide helpful and empowering, please share it. By discussing these topics openly, we help other men break free from shame and misinformation. If you have further questions, or if any pain persists, please don't hesitate to consult with your personal urologist.